Let's go.
Okay, and medical education second, the foundation program. The foundation program is a 2 years program training which forms the bridge between the university level student medical school and specialist of general practice training. It consists of a series of placements each lasting of 4 months, which allow the junior doctors known as a trainee to sample different specialties. For example, the pediatrician, after a year of training, correspond to pre-registration and house officers. That is PRHO. Post a year of tour trainees. To senior house officer post, each trainee has an educational supervisor who ensures the more senior doctors deliver training in different ways, including clinical and educational supervision. To progress, trainees have to demonstrate a range of clinical competitions, which are assessed through observation in the workplace. En la concentración del programa es un programa de 2 años de entrenamiento y forma parte del puente entre la universidad, el nivel universitario y la escuela de medicina, una especialidad general o o un entrenamiento de practicante consiste en una serie de planteamientos que lo más que puede durar son de 4 meses durante de un doctor junior o un doctor en entrenamiento conocido hacia el as a trainee. Em, para poner en ejemplo diferentes especialidades, por ejemplo, un pediatra, que es un trainee de más de un año, corresponde a una preregistración en la casa de oficina. Y también se postea a 2 años de entrenamiento como un encargado en casa de oficina. Cada entrenado tiene tiene un supervisor educacional que se asegura de tener más doctores especializados para entregar diferentes entrenamientos en muchas maneras, incluyendo como la cirugía, pediatría, etc. People in medical education, tutor, and academic or some cases of postgraduate graduate student who leads tutorials, demonstrated in anatomy teachings, someone who demonstrate who dissects demonstration are often postgraduate. Students praying their way through a medical school and academic with teaching and research responsibility who contributes to learning of a particular discipline. A senior academic with teaching and research responsibility for a particular discipline using a leader figure on their discipline. A consultant responsible for delivering a college training program and a consultant assigned to a trainee who provides training during the period of direct clinical care. Educational supervisor and consultant who supervise the trainee and period of training. Medical qualifications, BMCZ, BMSC, bachelor's in medical science, a degree of taken after 3 years of medical students by students who may wish to follow the career in a medical research. And bachelor in medicine, bachelor in surgery, bachelor in degrees, undergraduate degrees. This is the first degree for UK doctors. Doctor in medicine is the third one, diploma and of the Royal College of Obstetricians and Gynecologists. Member of the Royal Colleges of the Physician of the member of the Royal College of Surgeons. Doctors become members by successfully completing the assessment procedures in their college. Fellow of the Royal College Surgeons of England. Other colleges are indicated by the letter which follows the example Edinburgh. And how doctors become a fellow depends on their college for the FRCS. For their examinators must be passed for other college by nomination at work assessment. Now I'm going to read the exercise 12.1 and complete the phrases with words from the box. Two phrases can be completed in two different ways and look at the A and the B opposite to help you. And number one, demonstrated a competence how to do something, supervise a trainee by ensuring she successfully completes the training, deliver a course of a training program as a teacher, and for take a course training program as a student, and also access program to our customers. Oh, sorry, competence. Match two or part of the sentence and look at the B and the C to opposite to help you. Number one is going to be number D, number two H, number three F, number four B, number five G, number six C, number seven A, number eight E. Write the full qualification for the doctor surgeons. Look at the C opposite to help you. Sir A. Marne and John's husband, Bachelor from Medicine, Bachelor of Surgery, follow the Royal College Surgeons. Number two, Bachelor of Medical Science, Doctor of Medicine, member of the Royal College of Physicians. Bachelor of Medicine, Bachelor of Surgery, Bachelor of Medicine, and Doctor in Medicine. Now I want to read the last unit, that is their number 13, overseas doctor. And type of registration to manage and treat patient in the UK. All doctors must register with the General Medical Council. There are several types of registration. Provisional registration is the doctor who has just qualified for medical school in the UK for certain European and economic area member states. Full registration fees for doctors who have completed their year's clinical training. Limited registration is for international medical graduates who have not completed the equivalent for the year's clinical training in the UK. A specialist registration is for doctor who has completed special medication training and have certificate from practitioner of training. Okay, sorry. And now I'm going to talk about PLAB. And before you can obtain full registration, some categories of overseas doctors are required to take professional and linguistic assessment, board PLAB, and test. PLAB is designed to ensure those who pass can practice safely on the level of SHO in a first appointment in a UK hospital. Part of an aid consists of a writing test knowledge, skills, and attitudes. Part two is an objective structured clinical examination. If it consists in by 16 5-minute clinical scenarios. No assessment as professional skills. Lab station in advance also as skills, clinical examination, your ability to carry out physical examination of a simulated patient, an actor trained to play this role, and also be assessed uncomfortable or intimate examination will be carried user marker anatomical model. Practical skills, you will be assessed on a practical skills such as stunning and giving intravenous injections, communication skill, and history talking. Now I'm going to read the exercise. That is, what kind of registration might be those doctors obtain? Look at the A and to help you. A newly qualified Spanish doctor in provisional registration. A newly qualified Nigerian doctor limited registration. A doctor who has successfully completed the first foundation first year full registration. As SHO who has successfully completed the foundation program and gained the certificate of completion of training after several specialists registered. A specialist registration. 13 number 2. Write the abbreviation in the word. Look at the A, B, C, and opposite to help you. Any doctor who wants to work in the UK must register with the GMC. Any doctor who wants to work in the UK, okay, General Medical Council. Some overseas doctors must be passed the PAP test before can register. Professional and linguistic assessment mode. Part 2 of the test consists for an OSCE objective structured clinical examination in any emergency member and the ABC protocol airways breathing examination. And 13 number 3, complete the text. Look at the A, B, and opposite to help you. My name is Musa. I come from Yemen. I came to UK about 2 years ago after graduating because Yemen is outside the EEA. I could only obtain unlimited registration with the GMC at first. It was difficult for me to obtain the place of a foundation program, although they speak good English. I have to take the place of foundation program, and I had to take black also. This shows that I could work safely in the UK. And if I have to give some advice to other candidates, I will be that controlling situation. You shouldn't simply memorize a set phrases. It's better to really think about what you are saying to get actor and the information right. But I found too difficult to get an S. I showed posting my shoes in a specialty, pediatrician, and hospitals. Now we have to demonstrate there isn't a suitable candidate for the EEA. Once I've completed my second foundation year, I should obtain in a EEE once of CCT, which will allow me to proceed to a specialist registration with GMC, an important step toward becoming a pediatrician. And well, this is all of my exposition. My name is Ninos Casena, Irisena, and that's it. Thank you for paying attention. Muchas gracias por prestar atención a la exposición.